Dr. Jesse Greer,
Hey.
thanks for joining us.
Of course, yeah. Thanks for having me.
Tell us about yourself. Tell us a bit about Preamble.
Sure. So I'm a physician, internal medicine, prior military physician. So I did my training at Walter Reed Hospital, but then I was an Army doctor for about 7 years. Spent a lot of time on the operational side of things. So I was a battalion surgeon for 7 Special Forces Group for about 5 years.
Yep, awesome.
Got out and started a company called Preamble. We're a clinic. We're based in Scottsdale, Arizona, although we got clients all over. And we really just focus on prevention and performance-based medicine. So medicine for healthy people.
So then on that note, Jesse, give us your top 3 biohacks.
All right. One thing that I use for a lot of patients is manufacturing some time-bound goals.
Yep.
And by that, I mean, like in the Army, you had a PT test twice a year. How fast can you run 2 miles? How many push-ups can you do? And how many sit-ups can you do?
Was that the test?
That was it. It was that basic. And, you know, in the Special Forces, sometimes they add a few little more wrinkles to it, but it's pretty standard. Still, it's bragging rights. But anyways, you have this like goal to prep for it. So a lot of people study for the test, you know, starting maybe 2 months out there, starting to run, starting to do push-ups, starting to do sit-ups. But it just gives you this reason there's something to shoot for.
We all need it.
Yeah, exactly right.
So you're taking that same concept then into the work you do.
Yeah, you have to manufacture that stuff now. It's kind of boring. It's nicer when it's handed to us and you got to do it, but you have to manufacture this stuff. And so whatever people like, I think an easy one is like a 5K or 10K.
Yep.
Because those are manageable distances, and then you can apply some real training and make some real big improvements.
Awesome. So manufacture your goals. I love it. All right. What else? Number 2.
Number 2.
You were talking about hacking meal prep.
Meal prep. Oh, yeah. If you can account for 10 boring meals a week, I've never seen a bigger hack than that, right? I mean, there's all types of, crazy supplements and things that you can buy around here or people are trying to sell you. But finding a good way to account for those 10 meals. And they've got to be pretty boring. And so if you're sticking with your diet, if you've got a good outline of what you should be eating a week, and you can get in, a third of that in your breakfast and a third of that in your lunch, right? And it was sitting in your office or sitting at your home in the fridge, and that's all you were eating. That means you could eat dinner with the family, right? It's not really accounted for. Go out on the weekends. But if you were taking care of those times when you should have been doing something boring, the body composition, especially when we measure it in patients on, something that looks at muscle mass and fat content, it's drastic. And once you kind of get people seeing that, it's they buy in and then
I know you use both InBody and DEXA in your practice. And so if you're getting people those 10 staple meals a week, making sure those get in there.
Yep.
And the macronutrient profiles in there, you're seeing the benefits play out in the body composition data.
Yeah, especially when you're, increasing somebody's protein and pairing that with a good exercise regimen.
Yeah. All right, so hack the meal prep. And then the third one, Jesse, was a new one we haven't had yet, which is customizing your training zones. Tell us about that.
Yeah, so the key to, I think, any exercise, I don't know, we call it a pyramid or just whatever your strategy is, right? That base level, I think needs to be frequent movement, right? I mean, some people call it zone 2, but I think that confuses a lot of people.
Sure.
Because I think zone 1 is going to do just as much effect for a lot of folks, most of the common folks. And so where this gets a little bit tricky is in the folks who do go to the gym and do like to do cardio. Maybe they like to run, and they're weekend warriors, but they like to run fast. They like to get a runner's high. But what's interesting is that for those people, when they come and see me, they tend to have plateaued.
Yeah.
Right. They've been doing it for years. What am I missing? And I think by putting them on a treadmill or a bike and doing a metabolic exercise test and being able to show them that when they're running, like at their normal speed, when they're running 15 miles a week, they're hanging up in their zone 3, zone 4, burning almost all 100% carbohydrates, right? No fat. And the trick for these guys, whether it's to improve performance or to improve that fat burn, is to have them run more miles and not stress out their body. So that's going to be in that zone 2 area, And so by doing that testing for them, and usually a little bit more of an advanced exercise test where you're testing lactate or you're moving them up slowly through their zone 1 and zone 2 on this test, and you're finding their thresholds, and your design, you can output their custom training zones from that. and show them that, if they do want results, it's actually going to look a lot different. It's a great educational component because then you know where that slow, easy bulk of where your time should be.
Yep.
And then you can go into those high zones, right? And if you're taking care of those edges, then that middle tends to work itself out in the race. And
right on.
Yeah.
And so if people are listening and they're looking for a badass concierge doc, how do they find Jesse?
Preamble.co is our website. We're taking new patients in Arizona. We'll be putting a new place in Chicago in the coming months. Check us out.
Right on.
Yeah, we'll jump on the phone with you and tell you all about us.
Wish you the best of success, brother.
All right, appreciate it, Dave.
Yeah, man. Thanks.